Hello YouTube, this is Kezmaina. Welcome to my YouTube channel. This is a health and lifestyle channel where we talk about different health conditions and lifestyle modifications to accommodate the same. Today we're talking about family planning, which is not a health condition, but it's something that affects our health and therefore needs to be discussed in this channel. Yes, and so we start by defining, unfortunately, we're not going to be able to tackle the whole topic of family planning today because it's quite wide. I'll split it into maybe 2 or 3 depending on how big I find the topic, how wide rather I find the topic. So today we are going to tackle one, and then the days that follow, the vlogs that follow, will tackle the rest. So yeah, let's get into it. We start by defining what family planning is and what contraception is. Now wacha kwanza nianze na contraception because it's quite an easy definition. So contraception ni intentional prevention of conception. Yani intentionally you've decided you do not want to have a baby at this point, so you intentionally decide that you will not have that baby. You put yourself on a birth control method. It's as simple as that. And then there's family planning, which is the ability of a couple or an individual to attain their desired number of children within their right space and within the right spacing and timing. Yeah, that's what family planning is. Ni kujipanga tu kiuzazi, useme nataka kupata watoto wangu 3 within a span of 3 years ama within a span of 6 years, within wewe mwenyewe ni kujipanga tu, and yeah, that can be now assisted with contraception, which is intentional prevention of conception. Yes, so today we are talking about the IUD. Hizo zingine tutaziongea a little later, but today we are talking about the IUD. IUD ni intrauterine device ama IUCD. It can be either an IUD ama IUCD, intrauterine device ama intrauterine contraceptive device. This is a device that is inserted into your uterus. It's a T-shaped device that is inserted into the uterus, and it helps prevent conception. It helps prevent conception. Na kuna aina mbili za the IUD. There is the copper T one that is non-hormonal, and there is the hormonal one. Now, the copper T, let me differentiate between the two. The copper T one is a copper, imetengenezwa na copper, and how this works, it produces a chemical that causes a response, a reaction, an inflammation in the lining of the uterus that makes that environment very hostile for the sperm to survive. And even if that sperm survives long enough to fertilize an egg, the environment there is very hostile such that it cannot allow implantation. But most of the time it will not even allow a sperm to survive in that environment, in the thin lining of the uterus. I think am I making sense? I hope I am. Yeah, and now there's the hormonal one. The hormonal one is the one that now produces some hormone that thickens the mucus of the cervix and makes it impossible for the sperm to penetrate, and it also causes what? Jesus Christ. Ni kama tutakata tena. And causes the thinning of the uterine lining, thus prevent transportation of the sperm into the fallopian tube where the fertilization occurs. That's how the 2 different types of IUDs zinafanya kazi. And now the hormonal one is usually short term. Like I said, no, I didn't mention this, but now let me mention it here. An IUD is a long term, a long acting but reversible form of contraception. That means you can use it over a long period of time, that is between 5 years to 10 years or even 12 years, but let me use 10 years. The 5 years is for the hormonal one, because most of these hormonal family planning methods can't go longer than 5 years, but the copper T one can go up to 12 years, where it can be checked and you can place in another one. Yeah, so those are the two types of IUDs. And now I think we've understood how it works, and we are going to go into the advantages, then we get into the disadvantages and side effects, alafu tuingie kwa contraindications tukimalizanga. So advantages, moja, it's that it's long term and it's reversible, just like I've said, meaning you can use it for as long as you wish. That is okay, between 5 years to 10 years, depending on the type you've chosen to use. And it's reversible, so anytime you want to conceive, you can conceive. You can just remove it and you conceive. The other advantage it has is that fertility returns promptly or almost instantly. Once you check it, maybe within the next cycle you can conceive if you want to. That is another advantage it has. Another advantage is that it contains, even the one that has hormones, its hormones are not systemic. It doesn't have those systemic hormonal side effects that these other family planning methods do have, like causing high blood pressure, acne. There are people who suffer from acne due to family planning. And what else? It's highly effective. That's another advantage it has. And it has no drug interactions with other drugs. Like, for example, if you're on treatment for other conditions with other drugs, using an IUD will not have a negative interaction between the two drugs, you get. And then what else? It can be used by any woman of the reproductive age. As long as in the reproductive age, you can use the IUD comfortably. And what else? I think basically that's all. Oh, doesn't influence, it doesn't interfere with sexual intercourse. You can just have sex anywho, and it is effective as immediately after it has been inserted. It becomes effective. There's some family planning methods that require to be given at least a week. Nitawaambia tukifika kwa hizo methods. Right now I'm not very sure, but this one, it's effective immediately. Once it's inserted, it's effective. You're able to, now your contraception has begun. Yes. For the advantages, I think we are good at that. I've said that it doesn't cause any hormonal side effects. Even the hormonal one, the hormones act locally. Haina zile systemic. Yeah. Now I think we're done with the advantages of using an IUD, and now we'll go to the side effects. And the first side effect, and the one that is most commonly reported, is menorrhagia, dysmenorrhea ama polyragia. Wacha nizidefine juu mnataka kuniuliza hapo hizo ni nini nimesema. Menorrhagia ni heavy bleeding, dysmenorrhea ni painful period, polyragia ni heavy bleeding. And heavy bleeding with what? Mtu anikumbushe hapo chini kwa comments, nimesahau. But it's heavy bleeding and heavy and prolonged bleeding. Hizo tatu. It can cause you painful period, prolonged periods, heavy periods. Yeah, either of those three or all of them. That is the most commonest, and this usually happens between the like I've said, menorrhagia, dysmenorrhea, and polymenorrhea. Those are the commonest that is the commonest side effect that has been reported, but we're going to talk about the rest a little tukiendeleanga tu. So this occurs within the first 6 months, and if it exceeds, ikipitisha 6 months, ama if the flow is too heavy, you need to see your doctor itolewe, because at the end of the day, if you're bleeding too much, ama if you've been bleeding heavily for more than 2 weeks, my sister, you are going to get anemic, which is again not good for your health. So let's just say, try and weigh yourself, but within the first 2 to 6 months, you expect your period to be a little bit heavier than it was initially. The reason why this happens is because, remember, this is a foreign body that has been inserted into your uterus. When that happens, your body automatically responds by trying to expel it. When that happens, when it's trying to expel that, it causes a lot of contractions within your uterus and causes you to have excess bleeding. But then again, remember, I've said if it causes you alarm, ama if it becomes too heavy, ama if it prolongs beyond 6 months, beyond the first 6 months, seek medical attention. If need be, let it be removed. Usishikilie sana, and it could be causing you a health hazard. Yeah, so that is the commonest, and that's why I've started with it. The other one, the second one we're going to talk about is it doesn't offer protection against STIs and HIV/AIDS. It doesn't prevent to pregnancy. That is the other one. The third one, it can predispose one, ama it has a higher risk of getting what we call PID. PID ni pelvic Jesus Christ. Mimi ni Mkikuyu, I think I've mentioned that so many times. Pelvic inflammatory disease. It has a high risk of giving one pelvic inflammatory disease, ama uterine infection. Remember, this is something that has been inserted into your uterus. So if you have an STI, and STI, of course, it's an infection that is anywhere within your reproductive organs. That could be within your vagina, kutoka kwa vulva, vagina, cervix, tukiendanga. So this IUD is touching your cervix and then all the way back into the uterus. There is what we call an ascending infection. Bacteria wacha tuseme tu bacteria inaweza shikilia hiyo IUD from its end at the cervix, and it travels up to the uterus. It might cause you uterine infections, ama what we call pelvic inflammatory disease. Yeah. And while still on the same point, if you have an active STI, it's advised not to get an IUD inserted. And again, it's advised to have you screen for STIs before you get an IUD inserted, because unaweza kuwa hauna PID at this point kabla uinsatiwe, but tuna insert pamoja na hiyo infection, so we start having a lot of issues. And let me tell you guys, it's a bit difficult to treat a PID ama a uterine infection with a foreign body inside, ama with an IUD inside, because you're trying to treat but the vehicle is still inside, so you're clearing the infection and we are still bringing others, ama we are still harboring others. So yeah, that's how we do what. Yeah. So on the same note, I'm going to advise that if you are getting treated for an STI or a PID, your doctor, or maybe you may suggest this kama daktari wako aja suggest, I would suggest that the IUD get removed so that we can have adequate treatment for the same, because there would be no point on having to treat something that's not going away. Wacha tuitoe, we sort this out, and then we can put in a fresh one. Yeah. Another side effect ama disadvantage, hata si side effect, is that it can, within the first 3 to 6 months, there can be expulsion ama inaweza tolewa, because like I said, the first 6 months the flow is a bit usually heavier than normal, so during that flow inaweza toka. So it's always advisable, once you're removing your pad ama you're going to change your pad, you check. And also, you guys, well, when IUD is inserted, you're taught how to check if it's still there. You insert your 2 fingers into your vagina up to the cervix level, and then you feel for the strings at the cervix. Utafundishwa ukiwekewa kama hujaiwekewa. Yeah, so inaweza toka, which is another disadvantage. Another side effect is that uterine perforation may occur during insertion, and if this happens, unfortunately, you'll require surgical removal of the same. And Finally, this is a very rare, but it's something that needs to be mentioned. IUCDs expose pose a higher risk for someone to get ectopic pregnancy with the IUD in situ. Ikishatolewa, you are going to get a normal pregnancy, but with the IUD in situ, it's likely for you to get an ectopic pregnancy, because once if, and this is very rare, that's why I'm using the word if fertilization occurs, I mean if insemination occurs, it's impossible for implantation to occur in the uterine wall because of the thinning of the uterine wall, the hostile environment. So it finds itself attaching into the fallopian, unfortunately. So again, that's another disadvantage. And I think we are done at that with the disadvantage. Just with the disadvantages. So now we are going into the contraindications. And number one, undiagnosed abnormal uterine bleeding. If you have irregular bleeding that has not been diagnosed, hujui kama ni PCOS, hujui ni nini inasababisha hasa you're getting this abnormal bleeding, it's not advised for you to get an IUD in situ, because it could be a cancer of the reproductive organs, and it is now, this is the second contraindication. It's completely contraindicated if someone has cancer of any of the reproductive organs. Haufai kukuwa na IUD inserted. Another contraindication, if you have a current STI, current PID, or recent past. Hivi juzi kama 1 month ago ulikuwa treated for PID ama STI, it's advised you give your body time before you put in an IUD. Then current dysmenorrhea, menorrhagia, IUD inaweza worsen. Remember, we gave that as the first side effect people report. So if you're having 2 heavy periods, like as of current hujaitumia IUD na you're having 2 heavy periods ama very severe dysmenorrhea, it would be advised that you do not use it, because utaweka and then it could worsen your dysmenorrhea ama menorrhagia. And then an abnormally small ama an abnormally shaped uterus, that is another contraindication. There is the normal shaping of the uterus. We'll get into that in another vlog. See here, family planning. Tutaongea kuhusu the anatomy of the female body, female reproductive organs. So if you have an abnormally, but this the doctor will tell you, of course wewe mwenyewe huwezi jua kama uterus yako ni ndogo sana ama uterus yako ni abnormally shaped. Your doctor will tell you, and if that's the case, they will advise against getting an IUD inserted. And then I am reading the other thing I mentioned is that any malignancy ama any cancer of the female reproductive organs, the ovaries, the uterus, the endometrium, the cervix, hizo zote, it's contraindicated kabisa, usiwekewe. And then there is the structural heart disease with a history of bacterial endocarditis. Hiyo pia, because of bacterial endocarditis tends to cause infection away from the heart, inaweza sababisha infections kwingine. And we also don't want to risk that. We don't want to risk infection getting into the uterus because of the complications that arise from that. And then we are done with that, but what I'm going to finalize with is caution. Tulisema hakuna cautions. Nilikuwa nataka kusema cautions. Caution. We said, with an IUD in situ, you have to be very careful. Have one sexual partner, because if you do get first of all, an IUD will just prevent you from pregnancy. It will not prevent you from STIs or HIV. So have one sexual partner. So it is very difficult for you to get an STI from one sexual partner, especially if they're being faithful. So have one sexual partner and encourage your counterpart to have one sexual partner. I'm assuming your counterpart is male, because why are you on an IUD again? If they're female, you're not going to get pregnant. So encourage your male counterpart to stick to you alone, not to you and another one, wewe peke yako, because again, to avoid this maneno. Yeah, because now if you get an STI will lead to PID will cause you a lot of issue, and PID can even result to infertility. That's one of its complications, but well, it doesn't always happen, but why would we want to get there? Well, we are done. Thank you for watching. Remember to subscribe, share, like.